Hello, everyone. I hope you had a chance to take the Blue Marble quiz that we have up on the screen, or if you can take a few minutes to take it at the end of the webinar. It's really fun, and there's lots of great resources in the quiz. Um, so again, hello, I'm Karobi Acharya. I lead the Global Ideas for U.S. Solutions team here at the Robert Wood Johnson Foundation. I'll be your moderator today. This is our 19th episode for the Reimagined in America webinar series. If you're returning to the series, welcome back. And for those of you joining us for the first time, we're thrilled to have you. Before we get started, or as we get started, I wanted to take this opportunity to recognize and acknowledge that New Jersey, where RWJF is based, is the ancestral lands of the Lenape people, who were forcibly removed from their land and relocated west and north. While this land acknowledgement is one small act to pay respect to the original caretakers of the land, our team is also committed to continue learning about truth, healing, and repair processes globally, to understanding our history and the legacies of structural racism and colonization as a determinant of health, and questioning how knowledge is produced, recognizing the erasure of traditional ways of knowing. Before we dive in, I want to go over just a few logistics. If you want to turn on closed captioning, there is a live closed caption button at the bottom of your screen. Just select that button. You can submit a question at any time to any of our speakers by clicking on the Q&A button at the bottom of your screen. And please note that is easier for us than chat. We can try to grab questions from the chat, but if you put it into the Q&A button, if you use that button, that's better for us to make sure we capture it. The webinar is being recorded, and everyone will receive an email next week with a link to the recording and also any of the resources that we discussed today. So welcome. So we come together today at a dangerous time. As a global learner, I've been beyond dismayed to see our current administration withdraw from the world in many respects. I mean, can you imagine that a global pandemic treaty was signed by 124 countries, but the US was not one of them? Not taking part in this treaty means that the US is not part of any data sharing agreements. We're not part of the infrastructure that's being built to respond to the next global pandemic. Decisions like this obviously bring substantial risks to the health and well-being of the United States. And as the US government is withdrawing from global alliances and commitments and isolating itself from the rest of the world, it makes it that much more important that the social sector recognize our interconnectedness and that we act accordingly. RWJF is committed to creating a future where health is no longer a privilege, but a right, no matter how difficult the times. And we're committed to taking bold leaps even in the face of hostility and obstruction. For 10 years, yes, it is our 10th birthday this year, the Global Ideas for U.S. Solutions team has looked to learn from countries that have made progress in tackling the same kinds of problems that challenge our nation, and their experiences can now help us to rise to meet this current moment. In fact, there was a great article in Yes Magazine recently that offers learnings and hope from activists who are in Mexico, Lebanon, Bangladesh, Myanmar, and Thailand. These messages help people in the US navigate difficult times. And as you may know, all of these countries have faced their own versions of authoritarian regimes, human rights violations, and oppression. And as we strive to move forward rather than backward, it's critical that we listen to diverse communities' experiences, their knowledge and ideas, and continue to learn valuable lessons from and with each other. So I'd like to invite you to think for a moment about where you've turned to for inspiration and wisdom. Does your playlist include international artists? Do you have a poem that you love? Have you Googled different ways to treat a headache? Maybe you've looked to others for ideas on how to, improve your garden or use a midwife during your birthing journey. Maybe you've consulted researchers and academics from other countries to help guide your own work. When you start to think about it, most of us are learning from other countries all the time without even realizing it. So last October, Salzburg Global, which is an organization that's long served as a convener for important conversations on pressing global issues, Salzburg Global brought together leaders from around the world for a seminar to explore how we can embrace diverse voices and wisdom in our health research and knowledge. To achieve a health knowledge system that prioritizes equity and inclusivity, we have to rethink whose knowledge we value. We have to reimagine who does the research, how research is done, and what research is amplified. We have three amazing speakers today who were part of the convening, as was I, and they're going to help spur our thinking around the ways that we can produce and use knowledge to create better health. But before I introduce you to them, we always like to begin with a poll and want to hear from all of you. So we have two questions, which you should hear on your screen, which you should see on your screen, sorry. The first one is, in what parts of your life do you integrate diverse knowledge traditions? And if you can select the top two that come to mind for you. And then if you scroll down, you will see the second question, which is, why did you join today's webinar? And please check all that apply. One of the responses, please note, is I never miss a Reimagined in America webinar if I can make it. We're looking to increase that particular response. So just take a minute to respond to these two questions, and then we'll look at the results. And Kyle, just let us know when you have a bunch of the results in.
Sure thing, can do. We're at about 50% responding right now, so I'll say we'll leave it up for another 30 seconds.
Great.
All right, I'll be closing the poll shortly.
All right, so hopefully you can see the results on your screen. I love this. So the top responses on where you bring in diverse knowledge traditions, 42% do this in your research. That's fantastic. Physical health conditions, that's not a surprise at all. I think lots of us look to different traditions, whether acupuncture or something else. 37% with cooking. Wonderful. Love that. 34% policy and advocacy. That's fantastic. So why did you join today's webinar? 84% of you want to learn about diverse ways of knowing to advance health equity. 63% interested in what we can learn for other countries. And look at this, 11 of you, 15% of you never miss a Reimagined in America webinar if I can make it. And hopefully that is not all global team staff. But this is wonderful. And then 48% of you want to make connections. So that's fantastic. Thank you all for doing that. So now let me go ahead and introduce our fabulous speakers. Okay, great. So Mary Helen Pombo is the Director of Health at Salzburg Global, where she focuses on cultivating systems leadership to drive pro-equity change for health and well-being. She partners with forward-thinking philanthropies to equip leaders to recognize, navigate, and prepare for today's wicked health challenges and tomorrow's emergent, often unpredictable ones. Mary Helen brings nearly a decade of experience contributing to global health, international development, and gender equity initiatives in Africa, Europe, Latin America, Middle East, and the US. And Jennie Joseph, who will hopefully be able to join us. She is calling in from Ecuador and has had some connection issues. So hopefully she'll be able to join us. But I will introduce her. So Jennie Joseph is a British trained midwife who fights to ensure that every person has their healthiest possible pregnancy, birth, and postpartum experience with dignity and support. Jennie created the JJ Way, which is an evidence-based maternity care model delivering readily accessible, patient-centered, culturally congruent care and assistance to people in what she calls materno-toxic zones in the US. Jennie's the founder and president of Commonsense Childbirth. And Thirusha Naidu is the Canada Research Chair in Equity and Social Justice in Global Medical Education and an Associate Professor in the Department for Innovation in Medical Education at the University of Ottawa in Canada. With 26 years of experience as a clinical psychologist in South Africa's public health sector, her research centers on advancing equity and social justice in global health professions, education, mental health, and infectious diseases. Welcome, all of you, and so thankful to have you here with us. So I'm going to kick things off with a few questions of my own, and then we'll look forward to responding to questions from the audience. And just as a reminder to the audience, if you have a question, please enter it into the Q&A function at the bottom of your screen. All right, well, let's dive in. So, Mary Helen, I wanted to start with you. In October, over 50 global leaders gathered at the Schloss at the Salzburg Global Seminar. And one central question really resonated throughout the sessions, which is whose knowledge is valued? What are the reasons for that? And how do we embrace diverse ways of knowing to transform health research and knowledge? So would love to hear what excited you most about this conversation and what lessons did you come away with?
Yeah, well, thank you, Krobi, for inviting me. It's really my pleasure to be here with all of you today. About the program process, I'm always excited about the intentional way in which we design the program with participants that draws on different ways of knowing to support international exchange and collaboration. At Salzburg Global, we have the Salzburg method, and they are convening principles to foster a trust-based and an equity-driven dialogue. It's about creating spaces for tough conversations, incorporating and listening deeply to historically marginalized and community voices. It's for inspiring cross-boundary collaboration across generations, disciplines, sectors, geographies, and it makes us constantly ask that question of whose knowledge are we elevating, and how do we create the conditions for a more holistic exchange that sparks a heightened level of awareness or a new collaboration that will move the dial on transformative agendas such as this one. And it really requires a convening design that is much more than a didactic top-down approach and that asks us to galvanize minds and hearts. Just to be specific, we draw on intuition about the future. We use visioning and collective imagination exercises. We have a check-in to reflect on content and culture that we're seeking to build during that process. And that often opens up generative discussion about trust and inclusion. And the exercise is based on circle keeping, which is rooted in Indigenous traditions. And it asks participants to engage in radical listening, accountability to one another, shared power. I like to call these exercises mechanisms for self and group awareness, because it helps us to see ourselves and the dynamics that we're serving along the way. We also integrated generative scribing with the help of Celine Patron, and I know that we have a few photos coming up on the screen so you could see what that looked like. And she helped us not only to capture key ideas, but possibly more importantly, to capture what is not said, what is left aside, what is unspoken, or the unspoken mood and energy in the group. And again, this helps the group to become all the more aware of the invisible dynamics shaping our discussion. Now, speaking about dynamics, and I think in many ways we're also talking about power, I do want to highlight one very good initiative that was shared at the gathering, and that was the Cape Town Statement on fostering research integrity through fairness and equity. It was shared by Sabine Kleinert, who you might know as the senior executive editor at The Lancet. And I know that a couple of our peers here will pop it into the chat and you'll get an access to the link. The statement offers 20 recommendations for equity in research. And what I particularly appreciate is the emphasis on the role of local relevance and community-led knowledge. I think this deeply matters because the production of science is political. While any of us can appreciate how we came to use quick and catchy slogans like science speaks for itself and science is not for political debate and trust the science, because it served a purpose during COVID, an important purpose. But as we know it, the history of science reveals that science has been manipulated by politics of the time, and that there are strong power dynamics within the fields of science. And if we go back to the roots of mainstream scientific practice, and we go back to the European Enlightenment, to the 17th and 18th century, we'll see that there was a shift away from religious-based inquiry to the pursuit of knowledge based on reason, science, natural law. But there's this common red thread, even during this period of change, that is this quest to uncover a universal truths for human nature, for society across time, place, cultures, and that is immune to the bias of history, of politics, of the interests and experiences of the seeker of knowledge. And by the 20th century, empirical-based knowledge became the only valid form of knowledge production. And I think this had many dangerous implications and applications for health and equity. I think of examples of biological determinism, whereby entire populations were framed as inherently inferior. I think of, for instance, hysteria, a catch-all diagnosis for women at a certain point. Of course, Nazi-era eugenics. And even more recently in poor research, I'd say, on disease risk that sometimes frames significant groups of people as inherently predisposed to health risks without, or I should say, while understating the role of structural inequities in epigenetics. So it propagated this accepted scientific belief that certain people's bodies, their health, their intelligence were inferior, and it portrayed biology as almost inherently innate and unchanging. So it's a long-standing political tool, this usage of universal truths to justify social hierarchies. And I think we're risking returning to those narratives if we don't support inclusive, transparent data and knowledge production. I'm conscious of timing and I want to let others speak. So let me turn it back to you, Karobi.
Yeah, thanks so much, Mary Helen. And just to say, I think the method that you use in Salzburg is really incredible. And having now participated in that, it's really amazing how deep the conversations went. And I think Thirusha, I think you tapped into a lot of that depth because you ended our seminar with a poem that you wrote during the seminar. And, that is, to me, poetry and creative arts is an example of a tradition that is often not validated in scientific research and scientific knowledge. So I would love for you to talk a little bit about the role of creative arts in decolonizing knowledge, to use that phrase, and particularly in its role in Indigenous knowledge systems.
So much for that, Karobi, and thank you for the opportunity to speak. I want to start by acknowledging that I'm speaking to you from the unceded territories of the Anishinaabe and Algonquin people, and to say that I'm very grateful to have grown up in KwaZulu-Natal, South Africa, and learned about Indigenous health and ways of doing things there, and grateful to my ancestors who survived dislocation during the time of colonization from India. So back to your question, I want to start by saying the arts in general and poetry are not decorative. They're not necessarily just for entertainment. And I always like to think of the words of Audre Lorde, who is an African-American poet and scholar and civil rights activist, LGBTQ and race activist, who said very, very powerfully, poetry is not a luxury. It's not where we just add to conversations for entertainment. It is method, it is memory, it is medicine. If we think of any kind of traditional culture, there is always chanting, there's rhythmic chanting, there is prayer. This is all poetry, and at the same time, it is medicine. It connects this kind of chanting in any culture, whether it is a church or out in spirit or in nature. This kind of chanting and poetry connects us. So poetry endures. It endures in our DNA, it endures in our vessels, in our blood, long after policy that we strive so hard disappears. That we might not know the policy that was set up during certain times. We might remember things like the Declaration of Independence, but probably the most we remember of it is the most poetic line, which is "we the people." As soon as we start saying that, we get chills and we evoke it, and that is the poetry of it. It was written in that way because it speaks to the heart of us. So we might not remember the policy, but we do know the poetry. We don't know the politicians, we don't know who sat around the tables, but we know the artists and poets. Poetry speaks to the heart, it speaks to collective consciousness, arts in general. And we listen to poets like Shakespeare, Jimi Hendrix, Bob Marley, Alanis Morissette, Nina Simone, Billie Holiday, and we don't know the policymakers that wrote in those times. We know the Beatles because they wrote in such heartful language. I'm thinking specifically of a South African poet called Solomon Linda, who wrote a poem that he turned into music called Uyimbube, which means "you are the lion." And you'll remember that song or that piece of poetry as "The Lion Sleeps Tonight." That was in fact a piece of praise poetry to the strength of people who were oppressed under colonial rule. And it speaks with such rhythm, but it was protest poetry. And we remember it today because though we might not know, it was protest poetry against colonialism and the oppression of South African Black people. It speaks to us because we sense it in what he says. We sense it in the way he wrote the rhythm of that language. Even oppressors remember that. So in the work of decolonizing knowledge, poetry, like other creative arts, plays a radical role. Why? Because colonial knowledge systems have long privileged measurable, meaningful, written, spoken, objective method, where we have to learn the method. We need the numbers, we need the letters behind our names, we need to be professor, doctor, scientist, lots of language behind that. But poetry resists that. Poetry is what we hear in rap. It is what we hear when our feet tap. And it's what we hear when we speak from the margins, when we want to reclaim metaphors and silences and colonial education. It's what we get when we feel something. You know, how many times have we as women of color been told, "Why are you so angry? Why are you so loud?" But it's this anger and this loudness and this gut that makes us speak and write with passion, that speaks across generations. And it is a powerful tool for what decolonial scholars like the Walter Mignolos and the Frantz Fanons call, a big word, epistemic disobedience. And that is fighting against dominant knowledge and dominant ways of knowing and seeing and doing. this kind of epistemic disobedience, which is really fighting against how we know things and what deserves to be known, says, I will not know the world only in the ways that you, the powerful big you, has taught me. I will push and know my own ways. So instead of remembering that knowing can only come through legitimized knowledge systems, we need to remember that every story we tell our children, every story that we've heard, sensations is a way of knowing, dreams and ceremony. When we step back in group to take our place amongst groups of people who do ritual, who perform, who do things, this is a way of knowing that we carry in our bodies. And that's where Indigenous knowledge systems have victory, have power, have voice, have place way over our scholarly systems. Because when we sing our songs in, our traditional songs, whether it be in church or whether it be in our colonial systems, we are singing the songs and drawing the power of our ancestry. So every single one of us, whether we identify or are recognized as Indigenous, still holds in our DNA a long strand that reaches back to our ancestors, our maternal mitochondrial DNA, and our people's connection to the natures and the times when we used our senses, our intuition, our dreams, our bodies, to connect and communicate with each other, sometimes without speaking, sometimes humming, just touching, just singing the same song together in nature, under the stars. I'm thinking of places like Stonehenge. That is a place of ancestral healing and knowing, and that we all still go to because we revere it and we feel something through the earth and the place that we know we are allowed to and we can be part of Indigenous and ancestral knowledges. So we must do more than center them in curricula or footnotes or acknowledge them or nod knowingly or put labels on them. We must center them in our logics, their ways of doing their protocols, the patience and the respect that they have for flattening equity, but also the respect that they have for changing hierarchies in lands, in languages. And this means creating space for story, not just as illustration, but as story, as theory, where we have to leave space between ourselves and who we are telling and who we're hearing to connect around story and poetry. The mysteriousness of poetry, the mysteriousness of music, the kind of, what do they mean, is where the power lies. It allows us to connect our stories, that space between knowing and not knowing that always exists in language and in poetry and stories allows us to exist. And we know that because when we start off as children, we see it. We allow ourselves to believe the Grinch is real, that a red-nosed reindeer is part of Christmas, that animals speak, and we lose that along the way. So we all have it. And this is what my passion is around poetry.
Thank you so much, Thirusha. That, I think it is so true. And, I think as you were saying, this notion of tapping into our emotional space, our feeling space, our heart space is absolutely crucial. And Jennie, I want to welcome you. I'm so glad you can join us. As I mentioned, Jennie is calling in from Ecuador, so I'm glad it worked out. And I think when we talk about things like the arts and things like different ways of knowing, it can sometimes feel a little abstract or a little theoretical. And I think, Jennie, your work is in midwifery is just a brilliant example of how bringing those kinds of practices into the birthing experience has actual health outcomes. And you shared many of those stories in Salzburg. And so would love for you to share your thinking about this and perhaps share one of your stories.
Absolutely. And thank you so much for having me. It's wonderful to be able to speak to this issue. I mean, coming right behind Thirusha, her powerful words help us see how we can make sense of this. I think birth actually is possibly one of the best analogies of explaining that without explaining it. It just happens, right? And so I've been blessed over these 45 years of being in midwifery to see birth in all of its aspects, from all of its angles. And what we see is historically and continually, and just as human beings, we all do it the same way. And we all have the knowledge in our bodies, in our systems to know how to do it. And what we have instead is that where we have blocks to that, where we have impediments to that, we don't get to then fully experience it in all of its being, in all of its way. So I've been working in various environments. I've worked in hospital environments. I've worked in community birth centers. I've worked in home births where people are in their own environment giving birth, which is historically what we've done. And it varies according to where you are. It varies according to who's around and supporting you or not supporting you. It varies according to the interventions that happen. So when we started doing our work, we're working out of Central Florida in the USA. We have enabled and supported mothers and birthing people to be in their power. And by having access to that power, what we saw was phenomenal physiological changes, right? Like, think about this. As a Black woman, I'm very concerned and spend a lot of my work centering and supporting Black women and Black people through this experience, because as you know, in the United States, we have the worst in the developed world. The most outrageous and egregious statistics of preventable harms that are killing people, but particularly Black and Indigenous people. And that goes directly back to what we're talking about today. We're seeing how the interference and the inability or unwillingness to provide safety and support around birth, childbearing, parenting has caused to this much detriment that people literally are dying, are harmed, disabled, unable to be the same that they were before the experience in these United States. So we saw an immediate change, and the simple things that we were bringing to the table were such things as giving unimpeded access to safe, culturally sensitive, with humility, care, so that dignity and respect were retained, were maintained, were centered. That was enough for physiological change. So we have an awful statistic in the States where preterm birth is horrendous for people of color. Babies are born before their due dates, their full 40 weeks. There are many of them not surviving. They're in incubators for weeks or months on end, simply because of the color of the skin or the ethnicity. When we started doing our work, wrapped in midwifery model, of course, but also these additional aspects of support and care, suddenly the mothers were going full term. In fact, we had the opposite problem. Many of them were past the due date and begging, please get this baby. I am tired of being pregnant. But it was so interesting to see this immediate shift, very quick, and that once we established a relationship of trust in providing the care, it didn't matter whether persons had high-risk issues or not. They were able to thrive. And I think that speaks to the power of this knowledge that we all have in our DNA, in our very fiber, that left alone is there, will manifest, and can be, I think, the pathway to our liberation and our healing. So,
and Jennie, just give us one or two examples of what a specific practice might be.
So, for example, no one's turned away. If you approach us for care through our clinics and our birth center, you are not going to be told, no, your insurance is wrong, or you don't have enough money, or you're not in the right status, or the wind changed direction. No excuse at the front desk. Immediately enables folk to settle, to feel taken care of, to feel safe. And they open up. And once they feel able to share their knowledge, share their desires, share their needs, we in turn respond and listen to that first and foremost. Listening is a key to this work. And it's not complicated. In fact, it's even free. We don't even have to pay for listening, right? Like, this is not an expensive project or anything unusual or untoward. It's straightforward. And so we carry that on from the first encounter, whether it's a phone call encounter or in person, right through to the other end when a mother's moving on with postpartum, going on through their care, right out to parenting and being able to make sure that they and their family are off to a good start. So we start with this complete surround of access, connection, knowledge, empowerment. Their autonomy is intact, their self-determination is intact. And again, that brings the physiological change.
Yeah, amazing, amazing. So I do want to get to the audience Q&A but one question we didn't get to, and I think as we go through some of the audience questions, it would be great if you could maybe address this in your answers is thinking about this moment in time, under some of the challenges we're having in the US. How do we use the learnings from the Salzburg Global Seminar to meet the current moment and continue to foster global connection? So as our government is maybe pulling back from global alliances, how do we as civil society actors, how do we lean in? So let me turn now. So just, I guess, keep that in the back of your minds as we go through some of the audience questions. And if you have a question, again, please put it in the Q&A button, and we'll try to get to as many as we can. So the first question, and this may be for all of you, whoever wants to chime in, but this first question is, how might we communicate the real problems that exist in mainstream health research, such as publication bias, etc., while preventing declining trust among the public in scientific consensus? How do we address political opportunists who take advantage of this distrust to push fringe ideas? I mean, that is the question of the day, I think. So who would like to jump in and start?
I think I can jump in on that one, Krobi, because that's exactly the kind of work that I do in my real life. I can say that space has become a dangerous space because it has become the way the world is working at the moment. It's really difficult to speak out against powerful systems and people, because for the very first time in a very long time, there's actual physical danger to researchers and people that speak out. It's not just about having your voice not heard. You could literally be jailed or killed. But I think that the answer lies in collective action. The answer lies in collective action, and we have to move away from the top-down scholar to community communication. There needs to be reciprocal communication. And whilst we peer review in journals, we need to probably community review as well, and always do iterative and participant-oriented research, because collective action and collective voice is always more powerful. I'm thinking particularly of an example from South Africa with the Treatment Action Campaign during the AIDS epidemic, and where the South African government was denying people access to life-saving drugs. And it was collective action, not just from scientists, but people who were living with it, that pushed back against government who were killing people, that we now have a system that allows people to get free access to education. So to summarize, not top down from scholars to the community, but iterative and collective action always.
Thank you. Did anyone else want to comment on that? Mary Helen?
Yeah, happy to come in on that. I think there is something to be said. I just want to build on really what you've already said, Thirusha, about the bottoms up perspective. And I often think about the Brazilian health councils and how catalytic they are in terms of securing a space, a co-governance, decentralized space for continual engagement with communities. I think that's very different than what we have in the States, right? When we think of citizen engagement or patient engagement, it's been very sort of clinical. Clinical systems have these boards, and they engage with an advisory council with only a limited number of people. Now, the Brazilian health councils, they are decentralized and available in every region of Brazil. And they have a very official role, which is to regularly engage civil society, allow people to challenge health authorities, whether it's the scientists, whether it's the policymakers and the likes. It gives them, of course, power to then prioritize health agendas. But I think there's something there about the continual dialogue between communities and decision makers and scientists and whatnot. And it's not just any structure. I think there's something very special here about a co-governance structure. It's more than just a democracy, something there about the democracy that they have, right? I think currently what we have is we have, or at least, you know, at the moment, I know that this might be questioned, but in the democracy that we have, we're able to enjoy certain rights. We're able to, of course, vote for certain representatives. But in a deliberative democracy, we're much more engaged and we have structures there to be involved in day-to-day governance. And I do wonder, is this a key to future support our system to shocks like this? And I hope we never do have a shock like this. But I am always thinking about how do we future-proof what could be something that might enable more sustainable change. So I'd really encourage you to look at the Brazilian health systems, the experience in Colombia, which is also, they've done really good work with citizen engagement, and Rwanda as well. Different structure, but have achieved similar progress.
Fantastic. Yeah, yeah. This next question is a little bit about sort of how do you operationalize this? You know, I think there is a lot of discussion, thankfully growing discussion about partnerships between community organizations and researchers. And even with the best of intentions, too often those relationships do not, you know, do not sit well. And Jennie, I think you particularly might have some examples to share. So let me just read the exact question. This is specifically about credit and compensation. So I'd love to hear panelists talk about how they and their organizations credit and compensate communities when implementing their ways of knowing. And the questioner says, so many times knowledge production systems, both knowingly and unknowingly, use our ways of knowing, for example, indigenous, or our wisdom without citing, creating, or uplifting. So Jennie, maybe we'll start with you and then others can chime in.
Yes, I'd like to answer that with actually answering the part about operationalizing first, because I think that this is one area that we do have some control and power if we were to take it on seriously and incorporate it into the second half of your question, right? I feel like where the operationalizing needs to begin is at the top, just like Thirusha was mentioning. You know, the top-down approach has us locked into there's only one way of doing this, and then we can, you know, add some other pieces such as, oh, why don't we, you know, acknowledge our site or reimburse as an afterthought to the current and unchangeable, seemingly unchangeable system. What I'm wondering is when we got operationalized, we're operationalized in the institution, in the academy first, before we even get out the gate with here we come, we want to do this, that, or the third thing, right? Operationalizing, how are we training and supporting our staff, our teams, our students to be completely open to, before we even begin, this has to have a certain way of being. So I'm not just talking ethics, I'm talking deeper, like taking the onus on ourselves to figure out what is it that we need to get right real quick. If we want to talk about equity, if we want to talk about safety, if we want to talk about trust.
So well said. Thank you. Thirusha, Mary Helen, did you want to chime in on that? I think that the devil is in the details, right? Of how does this come to be in a way that is respectful when often incentive structures, particularly in academic and research institutions, often don't lend themselves to some of that. So would love to hear some of your thinking on that.
I think I can jump off what Jennie's just said, and what she talked about, I think is about relationship and responsibility and reciprocity. It's about action and accountability. So if I think back, and she mentioned something important about education, which means starting to educate whether they're health professionals really early. And I'm really grateful to have gone to university at a then black university in South Africa, where professors just kind of left us with the community and said, do what people want you to do. We're not going to tell you, speak to people. It was really hard when you came from a classroom and you learned from Western textbooks. But I'm so grateful for that. It's not about prescribing learning, it's about offering learning through community. So that's what I'm really grateful for. And I think other ways is to be true to the voices of people. When you're elevating voices, try not to put it through your own words and what you think is important through policy. So an example that I can say is that we once worked with a community organization in South Africa called Woza Moya, which provides health and social services to people in a community. And all we did was do a video of what people said their organization did without putting into academic terms. So creating open spaces for voice and starting to teach students really early to work with what Western ways of knowing and doing think is messiness, and be comfortable and be okay with that.
Thank you. So we have a number of questions here. So again, we'll try to get through as many as we can. This is an interesting one, and I think all three of you can chime in on this. What can we learn from how some systems of Indigenous knowledge have survived and are accepted and are being implemented? The example they give is yoga, which I have some opinions about, but I will keep them to myself. But what can we learn about how this science or this knowledge got accepted? Is it because of champions, or what do we know about that? And Jennie, I imagine, particularly in your work, you have a lot of examples. But yeah, who would like to start with this?
Well, I'll jump back in. Um, I think where I am right now, I think is really relevant to this question. I took my team from my midwifery school in the United States. We have a midwifery training program for community midwives. And we are here in Ecuador, Cotacachi, to work with a midwifery school that has been started by the traditional Indigenous midwives who are not recognized in the country. But they have called together Indigenous midwives from around Ecuador who've come together today, which is why I'm here. And it beyond, I can't even really use words to describe it, but they are doing such work in the communities. They are organizing, they are fighting a good fight. They are trying to hold these traditions. They are holding this ancestral knowledge. And they have some support. There are some researchers in amongst the groups that have come in today. But the researchers talk about such things as when the money's gone, the whole thing falls. Like, I think it's so important to recognize the power of the folk on the ground that we are trying to research, that our research will help, but to realize that they actually have the answers. Those are the champions of their own work. They've said things today that have blown my mind. For example, they want their name on the work. They want the recognition. They want to be seen and acknowledged. Yet we have a thing about we're not going to name them. We're going to do it this way. These ways are already in place. We just have to be open enough to figure out how we redesign what we're trying to do, because there's no shortage, obviously. We have to move from an extractive lens into a supportive lens so that we all win at the end of these exercises.
I love that. We have to be open to them. And, Mary Helen, I wanted to call on you specifically because during our seminar that we were all at, I think we struggled with this at times as a group even. And we had some pretty intense, passionate conversations about this, even during the seminar and even in the process of conducting the seminar. And you, of course, were facilitating it. And I remember, having a lot of empathy for you and sort of how do you sort of work this through in a way that is respectful and honoring and still tackling the real issue, right? Not, you know, brushing it over. So I don't know if you want to reflect on, you know, some of that experience, but I think that is part of what we're talking about.
I suppose this also connects back to the previous question, right? How does our organization give credit? I think there's something powerful about a co-development and co-led process to the program. So I speak with each and every one of the who we call fellows, right? Participants that join the program. And then their feedback shapes the program. And each one of the fellows has a role in the program. So it shouldn't feel, and in any ways, myself as director, I'm not the lead of this, really tried to put the individual, all of the participants in a role, right? Owning the content so that the group feels that they are owning this, and this also reflects them. I think that's a very important starting point. And I do think there's something very, very powerful about checking in on culture regularly. So as I mentioned before, I mentioned very briefly the check-in process. The circle keeping tradition means that we sit together at the very beginning, and we create a sort of special time for it. It's not like any other segment. We start with a little meditation. We start with a quote, and we ask people, how would you like to work with one another over the course of these 5 days? What kind of culture do we want to build? And each person, and we need to radically listen. I think it's the hardest thing, and I see this sometimes even when our leadership programs or whatever programs, people are so eager to work on these topics, but it's hard for us to sometimes step back and listen to others, even when we go through this exercise, because we want to validate or support others. But they have to mention one important value and how they'd like to see that come to fruition during that time. And then we keep going back to that because it's not easy. Sometimes with the best of intentions, we don't realize we're serving a power dynamic. You know, the simplest example I can give you is using acronyms, using expressions that no one else are tapping into, and concepts. And so there's a power in us checking in the group saying again, oh, you know, we're losing content, or we're not hearing really enough about this group of people in this conversation. If we want to honor the topic, we need to do so. So, and I think the principled way of working is really important, always coming back to principles, always taking us back to the higher level, goals and ambitions. And I think leaning into when we have discomfort, that's so important. And if I leave you with anything, and what I hope all the fellows got, and I hope all of you, if you have an opportunity to sit for an extensive period of time with people outside of your circles, it's so important, I think, to get opportunity for intense discussions with people outside of our circles, our viewpoints, our geographies, our sectors, to with humility challenge our own assumptions, to heighten our awareness about those tensions, lean into those tensions. I think they're opportunities, and they're not easy, as you mentioned, Kirby. They're not easy to flip into opportunities for discussion.
Thank you so much. I think we have time for one last question with a brief answers. So I think this connects back to one of the earlier questions, but how do we grapple with respecting and including diverse ways of knowing when some alternative solutions might be actively wrong or even harmful? How do we address that perspective? How do we address that with the perspective that every alternative idea is valid? How do we promote deliberative democratic health systems when libertarian arguments can also be made in this framework? So it's a big question, but very briefly, in like 1 minute or less, would love to hear just some quick responses. Thirusha, do you wanna maybe start?
I do, and I want to answer the controversial question, answer it by saying very controversially, who are we to decide what is right and wrong? Right and wrong changes based on who we are, what time we live in, what we are talking about. And it means being really uncomfortable because we have no right, any single human being, to decide because that's really a top-down perspective when we see someone as saying something that is wrong. So one of the ways in which we can unpack that is to think about how we think about informed consent and confidentiality. We value that so much in research and community work, but it's really, we are social beings. We whisper, we gossip, we share information all the time, and then we expect to corral people and create parameters around confidentiality. And that's really controversial because we think we have the power as the researcher or the policymaker to protect other people's integrity, when in fact every human being has agency. And when they speak as a human being, they know that they're putting themselves out there. When someone goes to Jennie's clinic and they're doing something as vulnerable as giving birth, they just had to trust that Jennie shares and her team shares in their humanity. So we have to have a profound humility and constantly ask ourselves, who are we to ask or even judge something as completely wrong? And I know it's really controversial, but it's almost kind of a mantra that you need to say to yourself and bring yourself to that humility. And when you have that question, I think one of the most powerful things is to seek consultation, laterally, vertically. Seek consultation if you feel uncomfortable about what is right and what is wrong.
I love that. I love that. You brought us back to the beginning, which is whose knowledge counts, which is sort of the central question of this. I'm afraid that is all the time we have for the audience Q&A, but we wanted to pose essentially the same question back to you all in the audience. And I want to thank our panelists for really just such a fascinating conversation, but would love to hear from the participants. How have you seen societies preserve knowledge that's under attack? And just enter into the chat, if you have examples or ideas on that, and we'll take a look at that. But Mary Helen, Thirusha, Jennie, I really want to thank you so much for this conversation. It was a privilege getting to know you in Salzburg, and it's been such a privilege to kind of bring some of our conversations there into this webinar and share it with folks here. I encourage folks to look at the links in the chat. We will also send those links out with our follow-up email, and particularly the Salzburg statement, I think folks will find quite interesting. So the Salzburg statement is the statement that came out of our seminar. So that will be very interesting. We will make the recording available to everyone so you can listen to the conversation later, and please share it with anyone who might be interested. And as you sign off, you will see a survey pop up. We take that survey very seriously and would really appreciate any input you have into making this webinar more impactful and valuable and useful to you. And I do hope folks take a minute. There's a lot of interesting things in the chat about responding when knowledge is under attack. So thank you all so much. Stay safe and be well, and I'll see you at the next Reimagined in America webinar. Bye-bye.